Imagine having a common health condition that rarely requires surgery. Now imagine being one of the few people that need it. You may have to imagine this, but it was reality for me. Pectus excavatum is a common health condition that is treatable. First, we will discuss what Pectus excavatum is. Then we will discuss treatment and recovery. The Journal of Pediatric Surgery states that Pectus excavatum is a chest wall deformity that is characterized by a sunken appearance of the front of the chest. There are physical symptoms of Pectus excavatum. Cleveland Clinic states that physical symptoms can include shortness of breath with exercise, decreased stamina compared to peers, fatigue, chest pain, and irregular heartbeat. The symptoms that I had were the shortness of breath with exercise, decreased stamina compared to peers, fatigue, and chest pain. I did not have irregular heartbeat. According to seminars in pediatric surgery, people with Pectus excavatum may not experience symptoms until adulthood. There are also psychological symptoms of Pectus excavatum. Cleveland Clinic states that psychological symptoms can include significant embarrassment from the appearance of the chest, self-esteem issues, and clinical depression. I personally would wear a t-shirt over my bathing suit because I did not want people to be able to see the Pectus excavatum. According to PectusExcavatumFix.com, children over age 11 have more psychological problems than younger children. So far, I have discussed what Pectus excavatum is. Next, I will discuss treatment options. Pectus excavatum does not usually require treatment unless there are severe physical or psychological symptoms. In that instance, there are a couple of options for surgery. The first surgery option is called the Nuss bar procedure. Seminars in Pediatric Surgery states that the Nuss procedure is the standard of care for surgical repair of Pectus excavatum in children. According to Cleveland Clinic, the procedure involves placing a curved steel bar in the chest to correct the Pectus excavatum. The bar is left in place for 3 years, and people have between 1 and 3 bars inserted. I personally have 2 bars, and you can look at the PowerPoint slide and see the x-ray with the 2 bars. So I've had the bars in for 2 years now, so I'm supposed to be getting them out in December if everything with the virus is fine and hospitals are open for elective procedures again. The second surgery option is called the Ravage procedure. Cleveland Clinic says that the surgery is the traditional and open approach. Dr. John DeFury states that the Ravage procedure involves making a larger incision, removing the cartilage responsible for the Pectus excavatum, and flattening the breastbone. So far, I have discussed what Pectus excavatum is and treatment options. Next, I will discuss recovery. Pectus excavatum treatment requires recovery. Recovery involves restrictions. Dr. John DeFury states that activity is very limited for the first 3 months. This includes no sports, heavy lifting, and exercise. I also had the restriction of not being able to lift my arms over my head for the first 3 months, and I also wasn't able to twist my torso, so I couldn't go like this for 3 months. He also states that other activities are restricted for 6 months, including contact sports and sports that require upper body rotation. Recovery also involves pain. The Journal of Pediatric Surgery states that surgery involves a prolonged and painful recovery. For the first month after surgery, my life was basically on hold. It was painful, but it has improved over time, and I very rarely experience pain now from the surgery, just every once in a while from the bars itself being in my rib cage. Although surgery is painful, the Journal of Pediatric Surgery also states that patients are often pleased with results, reporting higher levels of self-esteem and increased exercise tolerance. I personally have experienced higher self-esteem and increased exercise tolerance. I've also have the symptoms less often that I had before, so I experience chest pain less frequently, and I have better stamina now than I used to for exercise. I'm also tired less frequently. In conclusion, Pectus excavatum is a common health condition that is treatable. We discussed what Pectus excavatum is, treatment, and recovery. At the beginning of this speech, I asked you to imagine having Pectus excavatum. Now you have the knowledge to do so.